I just came back from a hair surgery conference in Morocco where I was invited to give a talk on artistic hairline design. Before I get into my main takeaways, let me tell you about my experience. I got the warmest welcome from everyone at the World FUE Institute and also all the people that I interacted with in Morocco. It was quite the international crowd with hair surgeons from all around the world. These people were kind, humble, happy, fun, and super enthusiastic about hair surgery. And it was also fun to see how excited they were to meet me. They've watched some of the videos and they thought it was really cool that I was there. These hair surgeons were there because they care about constantly improving their craft and doing what's best for the patient. They're driven by the passion of hair transplant surgery rather than the money that it can bring. As I said in prior videos, it's not about comparing country to country when it comes to hair surgery or even one clinic to another. It really boils down to choosing the right surgeon for you, someone that you trust and who you feel can deliver the best result. And now for my hair transplant takeaways inspired by this wonderful meeting. There are two schools of thought on how many grafts we can safely get during a single FUE session for more advanced hair loss. Most hair surgeons, including me, are in one camp where we feel that we can safely get up to about 3,000 grafts or so in a single FUE session. When needed, we can then do consecutive sessions about 4 to 12 months apart to further increase density or to work on other areas of thinning. The other camp believes in doing larger procedures over the course of sometimes even 2 days, where they're going above that 3,000 or so graft count to get more grafts to deliver more of an impact. These surgeons are harvesting at a higher density and going more extensively throughout the potential donor zone. And sometimes they add in harvesting from other parts of the body, including the neck, the chest, and even the back and other areas as well. Some surgeons are even doing what's called giga sessions, where they're harvesting upwards of 10,000 grafts or more over the course of about 2 days. The main advantage of these giga sessions is that you could potentially get more coverage and more density much sooner. But there are several real disadvantages of these giga sessions, and that was voiced by me at the conference as well as by several other surgeons. There's the potential for reduced regrowth of the grafts because the grafts are competing for a limited blood supply, so they may not survive if you implant too many grafts into a smaller area. And we know that our donor supply is limited, so as you start to harvest more and more and more, you're going to thin out that donor area. And these procedures can be physically taxing on patients, the surgeon, as well as the surgeon's team. And if there are any post-operative problems, a large percentage of your donor supply is now at risk. And the other potential disadvantage is that there are significant upfront costs with these large procedures. My philosophy is to create incremental improvements for the patient and not go for the home run right away. I think it's a lot more risky to do these giga sessions, and I like to see how things heal and how things regrow. So both the regrowth at the recipient areas and also to see how the donor area fares after one large procedure, and to see if patients are comfortable proceeding to additional procedures that will further thin out their donor area. I think the key with any aesthetic procedure is to always try to minimize complications and of course maximize patient satisfaction. So every surgeon and every patient has to decide where that balance rests for them. The next topic that came up a lot in the conference was long hair FUE. Now remember, there are several options when it comes to shaving for an FUE procedure. For some surgeries, you might shave both the donor area and the recipient area. For another type of procedure, you might only shave the donor area. And there might be a case for where you shave just the recipient area. And it's also possible to do a no-shave approach at the donor area and the recipient areas combined. Now, if you're not shaving your donor area and your recipient area, the hairs that are transplanted can either be transplanted trimmed so they're nice and short, or you can leave the hair long for the transplantation process. With newer techniques, it's now possible to do a no-shave FUE procedure where you're transplanting the hairs long, and that is also called preview long hair FUE. Some hair surgeons can harvest harvest up to about 3,000 grafts safely in one day. Now, there are several advantages to these long hair FUE procedures. One is that you can preview your result immediately right after the surgery. So you have the hair, let's say you're working on the hairline, the hair is brought in long. So now you have these long hairs at the hairline where you haven't had them maybe for years. And you can actually see how your result fares right after the surgery, as opposed to having those short little stubby grafts that are placed typically. So that is a big advantage for some patients because they can see how things will likely look after that hair falls out and then regrows. Now, another advantage is that you can see the full curl of the hair. So when you're positioning the hairs, whether you're working on the scalp or on the eyebrows, that can be an added advantage as well. Now, there are, of course, disadvantages to doing long hair FUE. One main disadvantage is that we know that the hair will fall out, as it does with all hair transplants. And we don't know if all of that hair is going to regrow. So that might be setting some patients up for some degree of dissatisfaction, if not all those hairs that were transplanted actually regrow. Another main disadvantage is that this is difficult to do. There's a steep learning curve. There are specialized instruments that allow you to do these procedures, but at the end of the day, the surgery just takes longer, so that's potentially more time for the grafts to be out of the body, which isn't always best for survival. It also makes it so that the day might be much longer and patients are stuck in certain positions. So again, it's not something that is commonly offered, but there are certain hair surgeons that only do long hair FUE. They are out there. It's also more difficult to manage these longer hairs, both in the process of extraction and managing them on the back table away from the patient, but also when you go to transplant those hairs, you now have the surrounding hairs that might be long, and now you have these transplanted hairs that are long, and that can make it so that the hairs can get tangled and just a little bit more difficult to track. There's also the possible risk of dislodging these grafts. If a patient goes and tries to comb their hair right after the surgery, let's say, or when they get home or the next day, almost forgetting that this is a transplanted hair, they could potentially pull out those grafts. And another disadvantage of the long hair FUE approach is that it truly cannot be done for curlier hair. So if you have super curly hair, this is not something that is offered really by anyone. In terms of my practice and my thoughts on long hair FUE, I think it's a great approach. I think it's something where when you start doing it, you need to roll it into the practice gradually and not start offering, really large procedures. So I'm waiting right now for the WA system, the one that I use for extraction, to develop that long hair FUE punch. They're in the process of working on it, Dr. DeVroy and his team. Once we have that punch, then I'll be able to start with probably eyebrow hair transplants. And so instead of doing a strip or an FUT procedure, which I typically like to do so that I have the ability to see the curl of the hair, instead of that, I might transition more to doing these long hair preview procedures with the proper punch. Now, another topic that was frequently discussed at the conference was medical therapy for managing hair loss. Almost all the hair surgeons that were there believed that finasteride or dutasteride are critical for maintaining long-term results. Most, like me, start with a standard dose of finasteride at 1 milligram a day and then titrate depending on the efficacy of the medication and if there are any side effects present. So that might mean up titrating to higher doses or switching to the more potent dutasteride if people still continue to lose their hair, or titrating it down to lower doses less frequent, like 0.5 milligram of finasteride, say every 2 days or 3 days, and going down to potentially even a topical formulation of finasteride if, for example, someone's having side effects. One important point that I think was made was that we should not rely on advanced age not to medicate a patient, meaning if someone is much older and they're starting to lose hair and they want a hair transplant or they're continuing to lose hair, we shouldn't say, oh, they're old, so they probably don't need finasteride. They still can benefit from finasteride or dutasteride, because we know that as we age, we'll all lose additional hair. And that goes for whether you're on finasteride or off finasteride, there's still going to be some drop off with age. So even if someone has had stable hair loss, they have the same pattern for, let's say, 20 years, and they're off finasteride and they want a hair transplant, there's still going to be some additional thinning. So most hair surgeons will still recommend putting the patient on finasteride. Now, another hot topic and something related to this is post-finasteride syndrome. We went around the room and asked, who's seen post-finasteride syndrome? To remind everyone what this is the thought that maybe if you take finasteride and then you stop it, potentially especially if you have side effects, those side effects will just linger on forever, and you'll always have issues with, let's say, decreased libido or decreased energy or whatever other side effect could come from finasteride. Now, when we went around the room and we did a poll basically to see like who's actually seen this in their practice, literally no one has seen this condition. I also did a podcast with Dr. Rossman, who has over 50 years of experience doing hair transplants and hair restoration. He also said that he never has seen like an actual convincing case of this. There are some reports in the literature that this might exist, and there are of course forums that, do a lot of fear mongering online. I never want to discredit the potential of this condition, but it's important to realize that this is not something that us as actual clinicians are seeing in our practice. So none of us were actually afraid of finasteride because of this potential for post-finasteride syndrome. But related to that, something that was stressed was that if a patient is experiencing side effects, it's very important that they feel an open line of communication with their surgeon so that they can report that. And so we don't continue them at that dose. What I usually do is stop the medication, wait for the symptoms to resolve, and that usually takes a few weeks to a few months, and then we can resume at a lower dose. So that's the proper way to manage it. But not going on it in fear of this post-finasteride syndrome when you're losing hair and you're very worried about losing hair is not the best way to go. And while I was there, I did tell some of the doctors about our Feel Confident brand, both the RX medications like finasteride that we have, as well as our new cosmetic products for hair loss, including our thickening shampoo, conditioner, and foam. And actually, some of them were interested in potentially stocking it in their clinics. And again, these are hair surgeons from around the world. So some of you have reached out to us asking, can you ship it to this country? Can you ship it to that country? We're limited in where we can ship easily from a warehouse in New Jersey. But if enough of these surgeons are interested, we could potentially give them a larger batch of our products, and it'll be easier then for many of our viewers to get their hands on some of these products. Now, another topic that came up a bunch in the meeting, and something that really got me thinking, is this idea of taking a more qualitative approach to hair transplant surgery versus a more quantitative approach, meaning one where you look at actual numbers like the thickness, for example, of the actual hair shaft, like the number of follicular units per centimeter squared that you're either harvesting at or implanting at, or even just a total potential graft count that the person might have over time. Some people are really calculating all of these numbers and using it in their transplant practices, while others are taking a more qualitative, more artistic approach to the procedure and assessing the recipient and donor areas in terms of just kind of overall global improvement as they go, whether it's after one surgery or after several surgeries, and monitoring with photographs and keeping track, of course, of graft count for the actual surgeries, but looking more at pictures and how the person feels about their results. That tends to be more of my approach, but some people are looking at specific numbers and trying to factor that into their decision making when it comes to counseling patients on potential procedures, or maybe even the effects of some medical therapies like PRP or like minoxidil or finasteride. And I think that both approaches have merit, and it's possible to combine the approaches for maybe the most optimal way to approach this. And there are also now some new technologies that allow us to do some of this in a more automated way. For example, it's now possible to use artificial intelligence to determine the total bald area. And that can help you with predicting the number of grafts that might be needed to create a nice result at the recipient area. It's also possible to determine the hair thickness and the density by using various different scanners that give you a pretty good idea of the composition of the hair. And there's also transplant mapping software that allows you to plan out your density distribution for the surgery. So I think a lot of this tech is really cool, and I think the numbers are in many ways important. But what I was trying to echo at the conference, and what other people were saying as well, is that you can't forget about the artistry that's so critical for creating beautiful hair transplant results. And all the numbers in the world are not necessarily going to lead you to an artistic result. But I think that if we use numbers and we use that to inform some of our decision making, while also looking at the kind of holistic element of a transplant result, then I think that's probably the best and healthiest approach. So I'm in the process now of trying to figure out which tech do I bring into the practice to take a more quantitative approach and to balance it with my artistic vision when it comes to hair transplant surgery. Now, another topic of discussion at WFI was interest in FUT surgery. FUT surgery seems to be a dying art. It seems like most young hair transplant surgeons are not even being taught how to do it. And most honestly don't even want to learn how to do it because they see what FUE can do and they feel like, you know, if you can get a similar number of grafts, especially over the course of several procedures, safely doing FUE properly, then why am I going to give people linear scars? And that seems to be the trend in people's thinking. So while FUT surgery still has its advantages, it's losing its appeal because of those unsightly linear scars that some people get. But as some people suggested at the meeting, with FUE surgery, especially once we get to higher numbers of grafts, whether that's done in a giga session, like 10,000 grafts, or whether that's done over the course of several procedures, are we exchanging one type of alopecia for another? Meaning that as you take this donor supply and you essentially are carefully moving it to the front and mid-scalp, crown over the course of, several procedures or a single procedure for someone with advanced hair loss, let's say, are we now creating a new type of alopecia where the back looks thinner than the rest? That is a different form of alopecia. Now, many patients would be okay with that because they'd rather have hair here than have hair in the back. But it's still a question of, are we properly balancing those densities and are we really giving people what they want? And that's something that's, I think, healthy to ask ourselves and to potentially be as cautious as possible as we get to these very large harvests for FUE surgery. And remember, if FUE is performed poorly, the scars from FUE can be just as damaging and unsightly as the scars that we used to get with FUT surgery. This is something that's so important. Some people think, well, I'm just going to get an FUE procedure, so it'll probably be fine. I think I'm going to be good. I won't have a line. But when some of those dots fuse together, you can have a really problematic appearance to that donor area. And here I'm going to put up the donor area for one of my patients who came to me as a repair case from another clinic, and they had their surgery done, by the way, in the United States, not abroad. And it was a real problem because we wanted to do some additional work, some repair work at the hairline, and yet we had to contend with this really unfortunate appearance to that donor area. So to do that harvest, we had to work around that over-harvested zone. So it's possible to mess things up with FUE. So patients who are looking to do a procedure need to do their homework to make sure that things are not just going to look better at the recipient area, but that the back is left as healthy as possible so that if you needed more grafts, you can go back in there. And also, if you decide to shave your head, you're not looking like you have some moth-eaten disease going on back there. And some surgeons out there only perform FUT surgery. Other surgeons only perform FUE surgery. Yet other surgeons will pick and choose depending on the scenario. So me personally, I mostly do FUE surgery with some notable exceptions at this time. The first is for eyebrow hair transplant. Because I like to see the curl of the hair and because I don't yet have that proper punch that will allow me to do long hair safely, I still do FUT surgery where I cut out a strip from the back. It's a very small FUT procedure, and that allows us to keep the hair nice and long to do very beautiful artistic eyebrow work. Another scenario is for a patient who's had a prior FUT surgery and they're pretty much requesting the same because they already have a scar, so we can usually incorporate that scar into the design of our additional strip, and in that way we're cutting out that old scar, leaving them with still one scar, and yet getting grafts that we can then use for their procedure. So that is yet another scenario where we still do FUT surgery. And another scenario is for larger procedures for women where, let's say, we're looking to lower the hairline and maybe we need 2,000 grafts, maybe we need 2,500 grafts. In those cases, the only way, at least in my practice, that we can do the FUE approach is to shave an area on the back of the head. But many women don't want a shaved region that will take time to grow back in. So many will opt for an FUT procedure where we'll still do the strip in the back and we'll get the grafts that we need. And in this way, it looks like nothing really happened with the long hair that's allowed to remain. The only thing that's left is that linear scar, but it's buried deep inside, the hair. But with some of the new advancements in FUE techniques, it's possible that all of those scenarios will be replaced with FUE. I don't know, time will tell. But surely some surgeons out there in the world have now moved to purely FUE technique and doing it at a very high level. But also remember that FUT surgery, when done properly, is still a very, very viable type of technique. And there are some senior surgeons that are proud to not even offer FUE, and instead they continue to get beautiful results with FUT surgery. So once again, I wanted to extend a huge thank you to WFI and specifically Dr. Bruno Ferreira out in Portugal. He's a wonderful hair transplant surgeon, and he is the one who reached out to me and said, hey, you know, we'd love to have you at our conference. Can you give us a lecture? And it was just the warmest welcome. Everyone there was like so nice, and sometimes I wish that we had that type of community here locally in New York City, but you know, it's a little bit different out here. But anyway, I plan to now attend every year. I plan to be a member of WFI, and the next conference is in Brazil. So I'm super excited to go there and to see now all my new friends. And I really feel like I'm now part of this wonderful, wonderful hair family. So thank you so much for that. And yeah, thanks for watching.